Morning everyone. I am Gafneet Kaur Pruthi, practicing clinical and child psychologist in New Delhi. Today I'm going to talk about oppositional defiant disorder, which is a kind of behavioral disorder which is basically seen in children aged 6 to 8 years, but it can also last throughout the teenage years, and even go into the adulthood. So, without wasting any time, let us see what are the symptoms of oppositional defiant disorder in children, and what one needs to do for treating this disorder, and why the role of clinical psychologist and psychiatrist is very necessary in treating oppositional defiant disorder. So what are the symptoms is that the child often loses the temper with the parents, or with the school teachers, or with any adult who is in touch with the child. The child is often touchy, the child often gets annoyed, the child often gets angry and resentful, he often defies and refuses, he deliberately annoys the others or often blames others for his or her mistakes and misbehavior, and has been spiteful or vindictive at least twice within the past 6 months. So basically what we have seen in these symptoms is that child is annoying, child is basically argumentative, child is basically defies, does not listen to parents, he basically deliberately blames others for his or her mistakes. Child is basically against every authority figure, and he does not listen to any of the good commands or the bad commands of the parents, teachers, or any of the adults, and he is living his life according to his own rules and regulations. So if these symptoms are present in your children, which I have just mentioned, then please, you need to consult the clinical psychologist, because there are some assessments which the clinical psychologists do, and the parental counseling which the clinical psychologists do, that how to deal with the child's behavior problems in oppositional defiant disorder. And sometimes if the symptoms are very severe, then we basically take the help of a psychiatric medications also for some period of time, so that little improvement can come in the child's behavior, and these behaviors does not interfere in his or her school academic areas or any other social occupational areas in which he or she is engaging. So if you find my information informative, then please click the like button and subscribe to my channel. And please, if you find any of these or all of these symptoms, or since last 6 months or 3 months in your child, then please consult clinical psychologist. And because the clinical psychologists have various strategies and techniques through counseling, by which they can improve the behaviors of your child, which will not interfere in his or her academic areas, and in his or her home environment, and his or her interactions, which basically always happens with his or her parents, that is argumentative. So thank you so much. If I have missed anything, then you can add that in the comment section.